access to the healthcare system with quality and equity is what every country in the world desires. The ideas and actions towards the collaboration among children, youths, adults, and relevant agencies in Thailand are the lessons for the world citizens from various communities, societies, or countries to learn from and share with one another, which will lead to the people's equitable physical and mental health status in their own context. Thailand post-2015, an emerging demand for long-term care, LTC, location, Lam Sonthi Hospital, Lop Buri Province. According to Thailand's population projection, the country is moving towards becoming an aging society. The proportion of population aged 60 years and over was 13.2% in 2010 and will rise to 32% in 2040. Importantly, some elderly persons have to be dependent on other persons, and their proportion has been rising due to changes in the socio-economic structure. Professor Dr. Rajata Nawin, Minister of Public Health, said, "In the Thai health system, the policy has been set to use the community-based and primary care approach in caring for elderly patients, with a linkage up to a higher level of health services. Under this system, we have family doctors and sub-district health personnel who are closest to the communities, working collaboratively with village health volunteers and officials of local government organizations." Here in Lam Sonthi district of Lop Buri province in central Thailand, a model of long-term healthcare has been established. Every morning before going to work, Bang On, a middle-aged woman in this district, has to routinely take care of her old mother, who is unable to help herself. This is a representative of Thai society in the transitional stage, even in the rural area. Having a smaller family, young people migrating to work in large urban areas, and leaving only children and the elderly to remain residing in rural villages. When such people get sick, they will face a serious problem, especially in the family that is unprepared. Luckily, Bang On's work as a formal caregiver or community caregiver is favorable to the caring for her mother. Such work is one of the mechanisms in Lam Sonthi's long-term care model. Lam Sonthi Hospital, the community hospital in Lam Sonthi district, is the starting point and core agency in developing the district's healthcare system, based on the principles of integrated district health system management, primary care, and community-oriented services in its own context. At the hospital, a primary care or polyvalent health team has been set up comprising multidisciplinary health workers or professionals with different service capacities, but they are able to work for and support each other. The team members have had skills in communication and counseling for individuals, families, and communities, and are able to apply and integrate various disciplines of knowledge in appropriately resolving medical and health problems. The team is also able to manage the holistic medical and healthcare system, in which Lam Sonthi Hospital serves as the network node, in collaboration with Tambon or sub-district health promoting hospitals, THPHs, serving as network members in running the long-term care system for dependent persons.
แนวทางของประเทศไทยเนี่ยการดูแลระยะยาวเนี่ยพูดถึงแนว
Dr. Santi Lap Benjakun, Director, Lam Sonthi Hospital, In providing long-term care, health and social services are to be carried out in an integrated manner, which can be called community long-term care, including home health care, in collaboration with all health and non-health sectors, using a systematic and continuous management mechanism. In the healthcare system for dependent persons, initially, the multidisciplinary team members comprising personnel from the hospital and Tambon health promoting hospitals in the district provided medical treatment as well as physical rehabilitation services at health facilities and at home. The services also covered physical and mental health care, including the improvement of environmental conditions that might affect health, with the support from village health volunteers. Somboon Sadan, a bedridden patient. What I am suffering from now is a result of cerebrovascular disease or brain hemorrhage. It occurred easily and unexpectedly, but it is hard to recover. The health team from the hospital often visited me and suggested that there must be a caregiver to help every day. After 6 months of such care at home, I feel better and have been trying to help myself as I sympathize with the health team that has cared for me attentively. Dr. Santi said, "There are some problems related to the shortages and non-continuity of health workforce. We have to resolve such problems by cooperating with other local agencies or local government organizations in getting additional budget for hiring community caregivers to help the official health team." Thongchai Mongkol Kao, Chief Executive, Nong Ri Sub-District Administrative Organization. The major role of local government organizations under the Ministry of Interior is to provide social welfare services for local residents. As we realize the importance of health services and conditions of community members, who are our relatives, with partial funding from the National Health Security Office, we can hire community caregivers for our villages. Regarding the role of village formal caregivers, their operations are supported by the hospital's health team regarding training in basic health care, planning, and follow-up support on a daily basis. In providing good long-term care for dependent persons, one important point is giving daily routine care with a good understanding and continuity. Today, Bang On and her colleagues are ready to provide such services. Importantly, today they are holding a meeting to prepare for taking Uncle Saman, an old male patient, back to his house. They are discussing how to clean and get the place ready for routine long-term care at home. In Lam Sonthi, a district with a population of about 26,000, there are about 160 dependent older persons, 70 of whom are bedridden, awaiting home health care, and Uncle Saman is one of them under Bang On's care. Long-term care is an important social service that requires a properly prepared living place and health care to be given by a family member or relative. Today, the healthcare team members from the hospital, as well as the Tambon or Sub-District Administrative Organization, are talking with the patient's relatives about patient care and several other issues after the patient comes back from the hospital. In the initial phase, the formal caregivers and the multidisciplinary health team members had to closely provide home health care. Later, when the relatives were ready to do so, they all would follow the routine procedures. For today, Bang On's role as formal caregiver for her old mother has ended, but upon getting home, her role as a daughter has to be undertaken.
ช่วงนั้นน่ะเหนื่อยแล้วก็แบบเหมือนว่า
Bang On Thao Sirikun, Community Caregiver. As a community caregiver, I have been trained in healthcare and gained experiences in caring for other people, as well as my mother. Initially, it was very tiring, but for my mother, I can take care of her. The significant healthcare facilities that support the functioning of the community hospital are Tambon or sub-district health promoting hospitals, as they serve as frontline service providers and are closest to the community, especially in rendering basic health services and supporting the roles of formal caregivers in giving long-term care for dependent persons.
บทบาทหน้าที่ของเขาเนี่ยเยอะมาก
Kamrai Piet Sung Neun, Director, Kutta Pet Sub-District Health Promoting Hospital. We have set up a team of volunteers to serve as coordinators between the communities and the hospital. The volunteers have been assigned to take care of elderly persons at homes in the communities. As our health service system is closest to the communities, we have the information for use in developing the service action plan. And we can follow upon the symptoms and health conditions of each patient. This is the way to solve the problem of inaccessibility to health services. Here at the Kutta Pet Health Promoting Hospital, a medical rehabilitation unit has been established and a physical therapist from Lam Sonthi Hospital has been assigned to work at the unit together with some village health volunteers and communities' formal caregivers under the supervision of the Health Promoting Hospital. Today, the health team members are prepared to make home visits to give physical and mental health care with empathy, which is the important foundation of rehabilitation services.
จริงๆแล้วถ้าอย่าว่าแต่นะถ้าไปกรุงเทพ
Somchai Potisit Sida, patient's relative. The patients are not abandoned. Rather, they are often visited by the multidisciplinary health team. The team is very helpful to the patients and relatives, as we may not be able to provide certain kinds of care. They can give us some advice, and we could gain more knowledge about home care, especially physical therapy. With their advice, I can now help my sick mother. Team of community caregivers. Whenever we face a problem, we will help each other to resolve it. We have received training in basic healthcare, so we can care for the patients at home. We work as a team with voluntary spirit and love. We are happy to do that for the elderly to help themselves and have a better life. It is a kind of merit making. What we receive is a good feeling and a bond of friendship with the elderly persons. Even though they are not our relatives, we are willing to help them. Based on Lam Sonthi Hospital's experiences in long-term care for dependent persons, the program has been upgraded and linked to non-health sectors and become a district plan of action in collaboration with several other sectors. Charin Thong Suk, District Chief Officer, Lam Sonthi District. We have an idea to extend this approach to other members of society, in addition to health personnel, to give more services to bedridden patients. Other sectors like community leaders and administration, as well as education officials, may organize special subjects such as basic patient care in school. As I am in the district administration, I will coordinate in setting up a concrete policy at the local level. Minister of Public Health. As for Lam Sonthi Hospital, the team of family doctors has admiringly established a long-term palliative care for terminally ill patients. The important thing that has made the policy implementation successful is the voluntary spirit of the personnel. That is regarded as one of the suitable models in the country that will integrate with other sectors related to social welfare services. The strong team of family doctors and society that provides home health care for the people is regarded as the extension of health services to the community, together with other sectors.